look, this is about choices. Everyone deserves to have choices in our lives. That's what we want, not just for ourselves, but for our family members. And we're clearly off the mark here in terms of how we have community-based, the number of community-based options versus nursing homes and how we're spending our dollars. You know, just to give you some data, you know, 41% of the states overall have a balance going over to home care versus nursing homes. In Rhode Island, we're using 26% of our Medicaid dollars on home care versus nursing homes. And there are 10 states actually in the country where they spend 50% or more in community-based partnerships and models. And so that's where we have to go. Now, the state needs to make sure that we're not just providing the resources, but rather that we're providing other resources within those communities. So this is not simply about the Medicaid rebalancing. It's also, if we're going to encourage more home-based community programs and staying at home, you have to have housing that's available. Either the zoning needs to be relaxed and there has to be a greater number of housing units where people can live as a multi-generational family, or you have you know, senior adapted housing that allows for them to better live. It also involves having transit options, having the livability in our communities. And so the role of the state goes beyond the dollars and cents and allocating X or Y in programs and buckets, although that's a part of it. It's as a state, how do we ensure that whether you live in Hopkinton or Providence or Central Falls or Westerly or Newport, you have an array of options that allow you to choose at what point you're going to be at home and at what point you're going to need and have to be in a nursing home if that's what's going to be needed.